And I say this all the time because I see moms in our clinic, in our lactation clinic. And, you know, I would always say to moms who are like, oh, I don't want to breastfeed. I feel like I don't want to breastfeed. And I'll be like, yeah, I know. I didn't know. I really, truly didn't know until that happened to me. I think in my practice, I've got 3 boys, right? Boy mom. So my boys are 9, 5, and Gray, who's my baby, is 8 months now. And he had a really severe anterior tongue tie. And after having breastfed 3 babies, I breastfed my kids for about 3 years. So I'd been breastfed for about 3 years each. So I've been breastfeeding for the better part of, you know, the last 9 years, really. And I remember with Gray, the pain was so intense that he would come to the breast and I would just look at him, and it was almost like this anger at him, right? I would look at him and I'm like, I don't want to do this. There was not a part of me that wanted to go through the pain that I was going through feeding him. We did get his tongue tie fixed at day 7, but I kid you not, guys, I literally was like, why doesn't anyone talk about this? What did I miss? Am I doing something wrong? Is something wrong? Like, it was just this feeling of pure, utter confusion, because I was born and raised in Zimbabwe, so watching people breastfeed was nothing strange to me. The discomforts of breastfeeding, I sat there thinking to myself, why does no one tell you about this? So I am hoping that by the end of this video, you guys are going to know what's normal, what's not, when to ask for help, when to go and get help from a lactation consultant, some of the few tips and tricks that you guys can employ on your own to kind of help you get a more comfortable breastfeeding experience, especially in those first couple of weeks when you first start breastfeeding. I also want to introduce you to some of the Haakaa products that can help you, especially when it comes to latching, and address some of the common concerns or common issues that result in you having nipple pain, usually related to you having a poor latch. Let's talk about some of the reasons why you might end up having nipple pain, or some of the things that may predispose you to have nipple pain. Now, let's just be real. For most of us, our breasts have never had that much friction, suction, attention, literally every hour and a half to 2 hours, 24 hours a day before. So needless to say, like everything else, there is going to be discomfort. So that's the first thing that I want you to know. Initially, in the first few days of breastfeeding, just because there's so much friction and moisture and the baby is sucking pretty hard, you are going to have a bit of discomfort. What we expect to see is you start the first couple of days of breastfeeding that discomfort comes up. About day 3, day 4, you're like, and then it slowly hits a peak and then it starts coming down. By the end of the first week, going into the second week, for most women, you're like, okay, this is slightly uncomfortable, but I'm kind of getting the hang of it. It's not that toe curling, oh my God, tears coming down your face pain, right? That's what we're hoping for. But if you're noticing that your pain is persisting, if you've got cracked nipples, bleeding nipples, fissures in your nipples, none of that is okay. None of that is normal. You do need to make sure that you guys have an LC in your back pocket. That is why I insist on getting prenatal consults, because you're going to meet your LC ahead of time. We're going to know you before you even have baby. We're going to see what your breasts look like before you have baby. If you come into my clinic, you know we take before pictures. So I want to see your breasts before you have the baby. And then after you have the baby, I'm like, oh, okay, those are rather flat, right? Your nipples may have changed a little bit. They may even get a bit bigger. So things continue to change even after you have baby. So it's really great for us to have that visual. And it's really important for you to have already struck up that relationship with your LC, and you're building that trust. So you're going back to that person, even though you all know how it is right after you have a baby. You're a hot mess. So you want to go somewhere where you can be your true, authentic self and really just tell them what is going on so you can get the help that you need. All right. So if you do have bleeding nipples, cracked nipples, an LC can, if you want to go really natural, can recommend Manuka honey. So Manuka is hospital grade honey. And you don't have to worry about the baby getting botulism toxin, right? Because it is hospital grade toxin. So we've gone ahead and they have treated the honey to kill any traces of botulism that could be in there. So it is safe for you to put on your nipples and breastfeed. However, you will need to make sure that you wash your nipples before you breastfeed baby. This at times can be even more irritating to moms who already have really sensitive nipples, to be putting on the Manuka honey and then washing your nipples before you breastfeed, then you're breastfeeding and you do the process again. So I found a lot of my moms complaining about it being a little bit tedious, but if you want to avoid medication, that is a great option and a great way to go. For years, Manuka honey has been used for healing third-degree wounds. So we know that it works, but again, it can be something that some moms find inconvenient. Another thing that you can get is all-purpose nipple ointment. Now that is a prescription, you get it from a compounding pharmacy. So you want somebody who can prescribe to write it for you. And it's going to have a steroid, right? That's going to help with some of the inflammation. It's going to have an antibiotic that's going to kill any infection that could be brewing or anything that could possibly lead to infection. And now think anytime you've got cracks or fissures in your skin, you have bacteria that lives normally on your skin. We don't want any of that bacteria getting into those cracks or the fissures in the nipples, because if it does, then you run the risk of ending up with a mastitis. Don't want that. Okay, so it has a steroid, it has an antibiotic, which is an antimicrobial, right? It's going to have an antifungal component to it, just in case you got yeast. Why are we worried about yeast? Because you're making milk. Milk is sweet, your boobs are warm, you're wearing a bra, you're wearing nursing pads, so you've got a warm area with sweet milk that is in the dark. Yeast is like, hallelujah, I'm going to go ahead and colonize this area. And so sometimes we have moms who come in and they're complaining of pain, and they actually are starting to get a yeast infection. So all-purpose nipple ointment goes ahead and it addresses that. When I prescribe it, I tell my moms to use it 4 times a day for about 10 to 14 days, really no more than 14 days. I usually want to follow you and see you on day 10 so I can see where you are and how the healing process is going. I recently had a mom who came in who had a bit of she actually had a crater. Like she had a little crater where the skin was missing on a nipple. She had dimpled nipples, so baby was really struggling to get a latch on. And so we ended up going all the way to the 14 days because I had to remind her that before she put the all-purpose nipple ointment, I wanted her to invert that dimple. I needed her to pull that dimple out and get the nipple ointment into the crater so that it would heal. Again, guys, anytime you've got like visible nipple trauma, or you're just in excruciating pain, I want you guys to see a lactation consultant. Some of the things that, some of the products that Haakaa has that can help you along your journey, especially when it comes to nipple pain, preventing nipple pain, and helping your baby get that deep latch. Now remember, in order for baby to get really nice far and back there, you want to make sure that your nipple is protruding. Sometimes you need to do a little bit of reverse pressure, right? Where you're just pushing back the areola so that that nipple can stick out. You're going to do this for about 45 to 60 minutes, right? And you're going to rotate your fingers as you do that right before baby latches. If you're super engorged, sometimes you do need to move some of that milk out, because as long as you're engorged, that areola and that nipple is going to be really taut, making it hard for baby to even latch on, making it hard for you to get that nice big hamburger latch, because what you want to do is give baby a nice big area to latch on. But they're not going to be able to come all the way back here if everything is pulled back and really tight and taut. So this is where the Haakaa pump, the Haakaa manual pump, can be super, super handy. And so you can put the Haakaa pump on about 5 minutes before it's time for you to breastfeed, especially when you're really engorged. Check out the video on how to put on the Haakaa pump. I'm going to give you a real quick tutorial. You want to go ahead and flip it, and then you're going to squeeze it. Okay. You're going to stuff it, and then you're going to flip it again, and then it will hold. So you want to keep it there for about 5 minutes. I usually tell my moms to get out about ½ ounce to 1 ounce, just enough for you to get that nipple and areola area a little softer to make it easier for baby to latch. Okay, the next thing that you can use from Haakaa, this is going to be great for my moms with inverted nipples, dimpled nipples, flat nipples, right? If you want to try and pull those nipples out and just get those nipples to stick out a little bit more. All right, these are Haakaa's nipple correctors. And I just love the little carrying case, because a lot of times this is where you run into trouble. You're like, where did I put those things? So you've got a little carrying case. You do want to make sure that you wash these and dry them out nicely after using them. They're all Haakaa products are made out of medical grade silicone. So love, love, love them. It has got a dome right here. Depending on how much you depress the dome, that's going to determine how much pressure or how much suction you're going to have. So you can depress it a little bit. You can depress it all the way in. And so what you want to do is depress the dome and then put it over the nipple area. Okay. Here we go. And it's just going to suck it all out. And just look at my skin there. And you can see it's pulling out my skin. And that's what you wanted to do to your nipple and your areola. Now, you want to make sure as you're doing this, as you can imagine, if you got nipple damage or nipple trauma, you do want to make sure that you're taking care of that, or you're at least working with somebody to heal that trauma, to heal that damage, because this is going to be really uncomfortable if you've got cracked, bleeding, fissured nipples. All right. So to wrap up, let's talk about the things no one tells you before you have a baby. And just a quick summary of nipple pain in general. Nipple pain in the beginning is normal. Again, like I said, your breasts have never been sucked on every hour and a half to 2 hours, 24 hours a day, nonstop, with something with immense suction. Now, you know, if you've used a breast pump, your baby's suction is stronger than a breast pump. So you've got a little piranha on your nipples. You're bound to have some damage as your nipples kind of get initiated into the breastfeeding process. So you're going to have a little bit of discomfort. Again, usually the first few days, about day 3, day 4, it peaks, and then it starts working its way down. By the end of the first week, going into the second week, most moms are like, you know what? I'm good to go. We're good. Second thing I want you to know, worsening, persisting nipple pain, not okay. You need to make sure that you're talking to an LC, you're talking to a medical provider, get the help that you need. It is not okay for you to continue to be in pain. It is not okay for the pain to be getting worse. It could be something related to how baby is latching, which an LC can help you with, or it could be something to do with baby's anatomy. They may have an oral restriction, which a good LC should be able to help you identify and kind of walk you down the path of getting that fixed and what that would look like for you guys. Number 3, there are remedies for flat nipples, dimpled nipples, inverted nipples. It is important that if your nipples, quote unquote, look anything other than the normal or a variation of anything that we normally see, right? Your textbook nipples where you've got the nipple sticking out, the areola. If your nipples look different, right, you want to make sure that you get a prenatal consult, because before you have a baby, we can probably help you figure out ways in which you can get a comfortable latch when baby comes. We can start working on pulling out inverted nipples. We can start working on shaping or molding flat nipples. We can help you learn how to put these on correctly, right, before you have a baby. And most importantly, you can order these ahead of time. And a lot of times, some of the things that we can do for like inverted or flat nipples, we can start doing right about 39-ish weeks with your OB's approval. So you want to make sure that you get your OB's blessing, because anytime you have nipple stimulation, you do run the risk of stirring up labor. So we want to make sure that your OB is okay, your OB is aware, and it's like all systems ahead. Let's just go ahead and do that. All right. Number 4, it is normal to feel like it is normal to not want to feed your baby. As a mom, as these thoughts are going through your head, I felt like a bad mom. Like I was like, what's wrong with me? There's nothing wrong with me. It's not normal to be in that pain. No one should want to be in consistent, incessant pain. Pain is a form of torture, right? So we know that it's not normal. I want you to know, if you're that mom who's sitting there going, oh my God, this is so painful, I don't feel like feeding your baby, that you're not alone. You're definitely not alone, that you shouldn't be in this much pain, that it is okay to actually get some nipple rest. So there'll be times when moms are like, it hurts so bad, I don't want to nurse my baby. And we can talk about a nursing pattern that allows you to get some nipple rest and get the nipple some time to heal. Skipping a feeding or 2 can completely revolutionize your breastfeeding journey when you're in a lot of nipple pain, when you're waiting for a tongue tie to be fixed, when you're waiting for that apno to kick in. Just in case you're wondering, usually within like 24 to 48 hours, when you start using apno and we fix the latch, then everything is starting to get better. So a lot of moms are like, oh my God, that feels so much better. And again, once if we don't fix the latch, right? If we don't fix the cause of the nipple pain or the nipple trauma, then it's going to continue to happen, which is why it's so important, if it's persisting, that you see an LC, if it's a tongue tie and you want to breastfeed, that is something that we consider addressing so that you can have a pain-free breastfeeding experience. But I just wanted to talk to the moms that are out there that are like, you know what, I just felt like a bad mom, or I felt like a terrible mom, or the moms who stopped breastfeeding because it hurt. No, the nipple pain is real, and pain is so subjective. It is what you tell me it is. And my goal, and our goal as medical providers really should be trying to get you to a place where you can nurse comfortably. You can nurse and not be in pain. It is not okay for you to be in persistent, excruciating pain. That's just not okay. All right, last but not least, get help. Get help, get help, get help. It's so important for you guys to have your LC, have somebody who can help you troubleshoot things whenever you guys do hit those bumpy roads. Get help sooner rather than later. A lot of times moms are coming to me again when you guys have got hamburger meat for nipples, and at that point in time we are doing a lot of nipple rest. Yes, when you do nipple rest, you do run the risk, right, of using a bottle or using an artificial nipple. When you do that, you do run the risk of causing nipple confusion and baby not necessarily wanting to come back to the breast. But if we can get you early, enough, we can take care of the nipple pain, we can fix the latch, we can fix what's going on with baby's mouth, and we can prevent the baby from getting too many bottles within those first 4 to 6 weeks, which would then lead to nipple confusion and possibly breast refusal. All right, so that's what I have for you guys on nipple pain. Go ahead and put your questions in the comments. I will be checking them and responding back to you. Don't forget to hit the subscribe button, and don't forget to hit the alert button so that you know when we've got a new video up. All right, mamas, it has been real. I hope you learned a lot about nipple pain, and I hope to see you guys soon.